Hello, I'm Dr. James Boswell, and I'm happy to be here on behalf of my co-author, Dr. Michael Costantino. Michael and I have collaborated on a soon-to-be-published book on deliberate practice in cognitive behavioral therapy, or CBT, which is part of a series on essentials of deliberate practice by the American Psychological Association, being edited by Tony Rumnier and Alexander Voss. In this short video, we'd like to provide you a brief introduction and demonstration of the deliberate practice methods in the CBT training and professional development the book addresses. The prototype for today is 3 participants, a supervisor, which is me in this case, 1 trainee who volunteers to role play as a therapist, which will be Della Scharf, and 1 trainee who volunteers to role play as the client, which will be Bethany Harris. Della and Bethany are both clinical doctoral students at the University of Albany. They've kindly volunteered to help with today's demonstration. Within a CBT framework informed by consultation with CBT treatment developers and researchers, as well as a network of pilot sites across multiple countries, we identified 10 skill domains and associated client deliberate practice stimuli. Within each domain, we then specify a list of 3 to 5 skill criteria that we want the trainee who's playing the therapist to try to follow when responding to the client prompts. The supervisor then uses the skill criteria when assessing the role play and providing feedback. It's important to note that a good therapist response doesn't need to include all of the specified criteria, which I will list shortly. Rather, we generally aim for each response to try to address at least 2 of the criteria. This is because prompts are varied by design and might not call for drawing on a particular element. In this particular example for the demonstration, we'll focus on the skill of assigning and reviewing between session activities, also known as homework. Bethany and Della, I just want to thank you again for doing this role play today. And so we'll say a little bit about the skill. So between session practice and activities, they're a core component or a core feature of CBT. Relative to the remainder of clients' lives, they spend in direct contact with the therapist. It's a drop in the bucket relative to all the time outside of the session. And so between session activities facilitate corrective learning processes, both in and outside of the CBT sessions. Also work outside of the session assists with generalization and helping the client become their own therapist. So although completing homework can certainly be a challenging activity for clients, there's a general expectation that some form of homework be incorporated across most sessions. Thus, when socializing clients to CBT at the outset of therapy and also as needed throughout treatment, setting this expectation and discussing any questions or concerns the client has is important. In particular, therapists should emphasize how homework can help generalize the skills learned in and experiences of therapy in daily life outside of the therapy appointment. So given its ubiquity, we view assigning and reviewing homework as a basic skill. That doesn't mean that it's simple or straightforward, but it's relatively bread and butter CBT. When following a typical session agenda, we make sure that time is budgeted at the end of each session to collaboratively identify between session activities, such as experience monitoring, behavioral experiments, exposures, or other even relevant readings. In turn, time is then budgeted at the beginning of the subsequent session to review the previous session's assigned homework. And so for this particular exercise, we will be using the following skill criteria. One is provide a rationale for the homework assignment so that there's a clear understanding of it. Tailor the homework assignment to the client's concerns and needs. Ensure that there's adequate agreement on and understanding of the homework assignment, and encourage and validate good faith efforts. Okay, baby steps. So those are the criteria. And so I think we're ready to move on. And so the floor is yours, Bethany and Della. Again, Bethany will be playing the client here. And Bethany, you can go ahead and start by reading your first client stimulus.
I have a hard time with organization, so I'm worried about doing all the homework correctly.
Thanks for letting me know that. That's a really common concern. We can talk a little bit about ways to make sure that you feel organized and prepared for what you have to do this week. And it's also okay if you don't do all the homework correctly. Sometimes a good faith mistake can actually be a really good learning opportunity and will give us a lot to talk about.
Okay. How did that feel, Bethany?
It felt solid. I felt like she heard what I said and sort of validated that I was concerned.
Yeah. Healthy dose of validation. I like that. You you even used, I think, the phrase good faith effort, or and so definitely encouraging those. And the tailoring was sort of embedded in what you were talking about by really inviting, sort of using collaborative language, that this is something that we will be doing together, and it's something that you're going to navigate together. Okay. So let's go back. Let's actually do that again. So Bethany, we'll have you use the same stimulus, and we'll take another turn.
I have a hard time with organization, so I'm worried about doing all the homework correctly.
Yeah, that's actually a really common concern. Let's see what we can do to make sure that you feel prepared and organized to do what you need to do this week. And I also want to make sure that you know that doing all the homework perfectly correctly isn't necessary. If you make a few mistakes, that'll give us a lot to talk about and can be a really good learning opportunity too.
Okay. In there, once again, I think you hit on everything, even though the response was a bit different. You hit on everything you hit on before. What I think you added, based on what I heard, was a prompt or a stay tuned sort of comment that we will make sure that there is a shared agreement on what the plan is going forward. And part of saying, sort of normalizing that, this is difficult stuff. If it wasn't difficult, you probably wouldn't be here. It's acknowledging that the most relevant parts for any given homework assignment, that's something that you're going to collaboratively determine, like what is particularly important and what can you anticipate maybe will be the stumbling blocks, and sort of normalizing that there will be stumbling blocks. Okay. So good. So let's actually do it one more time. And I think you're hitting on most of these.
So some things I'd like to highlight for the viewers, with deliberate practice, we're really trying to emphasize and privilege the behavioral rehearsal. So you'll notice we're not getting into research, we're not getting into extended theoretical discussions about CBT or anything else. We're really just trying to get in as many reps as possible so Della can kind of experiment and discover her own style as a therapist. So one of the basic principles of deliberate practice is we want to target the rehearsal to the skill threshold of each individual trainee. So they're practicing in what's called their zone of proximal development. So it's not too easy, nor is it too hard. So in the books, we have difficulty assessment forms for trainees to assess the perceived difficulty of the exercise. So Della, if you look at the form right now, how challenging was it to fulfill the skill criteria for this exercise, 0 to 10?
I would say maybe around a 3 or 4.
Yeah, okay, 3 or 4. So according to this form, that's pretty much in the too easy. I mean, it seemed like you were really nailing it. So what that would tell us is that if we just keep doing a lot more rehearsal at this difficulty level, you won't benefit as much. So we should probably increase the difficulty of the client statements. But let's go on a bit to question number 2. Did you have any of the reactions in the good challenge or too hard categories? And before you answer, I want to emphasize, please don't tell us any of the individual reactions, but more just yes or no for each category, right? So us or your supervisor or anyone else knowing about your inner experience won't necessarily make you a better therapist, but you knowing about your inner experience will.
Okay. So did I have any of those reactions?
Yeah.
Yeah, a little bit.
And in the good challenge?
Mm-hmm.
Anything in the too hard?
No.
Okay. So that confirms what we thought from question number 1, that this is probably too easy. So let's proceed to a harder client statement.
Client's choice, Bethany. I know we're raising the stakes a bit, so it's go ahead and ask away, or statement away, stimulus away.
Okay.
Sorry.
Pick one I think is most relevant. I didn't do the homework. It didn't seem that it was important, to be honest.
Well, I'm glad that you let me know, because, this can only work if we're honest with each other. I'd love to hear more about what didn't feel important about it, or maybe what came up when you thought about doing it.
Good acting on Bethany's part this time. So what I noticed immediately was the non-defensiveness. I mean, this is a difficult statement to address in session with a client, and so non-defensive stance, exploratory stance. So inviting exploration, accepting the fact that there is definitely some sort of, maybe a rupture appearing here in the context of the homework assignment. I think that's a really nice first response. So let's do it again and keep the acting chops going. Yeah.
I didn't do the homework. It didn't seem like it was important, to be honest.
Well, I appreciate you letting me know. I hope that by being honest with each other, we can come up with something that does feel important. Maybe it was my mistake to not check with you that this was something that you were willing to do before I assigned it. Can we talk a little bit more about what your objections were with the homework, or what came up when you started to think about doing it?
Okay. What I like about that response that time around is that you actually are hitting on another one, or even more clearly, I think, in the first round, one of the skill criteria in terms of the establishing the agreement and the understanding of the homework assignment. Part of what you're doing is sort of acknowledging that maybe that was insufficient, despite your best efforts, and so again, it's an invitation to do that, be non-defensive, but also reinforcing the notion that it is particularly important that you do establish adequate agreement regarding what the plan is for the next week. And then again, also trying to be thoughtful about personalizing it, understanding the nature of the client's particular concerns. I like what you added in there. So how did it feel, Della, over the rounds?
Yeah, I appreciate your feedback. I think I can see how the way that I did ask about that particular assignment could be an invitation to talk about broader issues, but I also think there might be some versions of what Bethany's feeling where that didn't feel as relevant. Maybe if she did just not buy into the concept of homework in general or something like that, maybe what I said wouldn't have been as good of a question. So it was helpful to sort of think about that. But yeah, I think it definitely I got a little more comfortable over the rounds. I liked being able to try out taking the responsibility and then trying a different way of going about it. It was helpful to try it a few different times.
Good.
But thanks again.
Sure. No, thank you. Thanks for
That's fun.
organizing this.
Sure.
Thanks.
All right. See you guys.
Take care.
Bye.
Bye.
Bye.